We'll talk about something more serious. Dr. Chad Fortun here with New Hanover Regional Medical Center's Orthopedic Hospital. We're talking about hip arthroscopy, which I admitted to the doctor I had never heard of, but in the talking that we've done, it sounds very similar to the things that we do hear of with sports-related injuries. Knee arthroscopy, exactly what is the procedure?
So hip arthroscopy is a minimally invasive type of surgery, and it's done through 2 or 3 tiny incisions, no bigger than the width of your fingernail.
Yeah, that's the part that blew me away.
And it allows us to get access to your hip joint, which historically is a very deep-seated joint in the body and difficult to get access to. But with the advent of improved technology, improved equipment, improved techniques, we can safely access the hip joint now with these small, minimally invasive incisions.
And the minimally invasive part, I guess, is also key to the recovery time with people getting back on their feet.
Correct. Some of the problems that we had to deal with before that we couldn't get access to necessitated a big surgery, a big incision, dissection through muscle, tissue that required a long process to recover from. And so with these tiny little incisions, we can get access safely to the hip joint and treat a lot of these things that we weren't able to treat before. When
you see injuries to the hip, you don't like to generalize, but oftentimes we hear hip, you think of someone a little bit older in life. Can people as young as teenagers, 20s, 30s, is there any ageism in an injury to the hip?
There is no age specification, but it basically depends on the pathology or the problem. Okay. So we've seen patients that are obviously in their teenage years. We've seen patients that are in their geriatric years or 60s, 70s. And the key is to obviously diagnose the problem. There are so many different things that can go on around the hip. There's 20+ muscles that just cross the hip joint alone. So it could be a simple strain or sprain or even just a tendinitis. But if they're having problems in the groin, which typically implies that there's a dysfunction in the joint itself, that's something that we look closely at, and that's something that we can treat with hip arthroscopy. And some of the 2 common things that we treat are hip impingement or labral pathology, which is what people have probably heard of. And on this model here, I put together some clay, a little bump on the femoral neck, and as you flex the hip and initially rotate, sometimes that bumps into this labral tissue here, and that can lead to tearing of the labrum and damage to the articular cartilage inside. And so if we can get to that early enough, we can get in with the scope, we can shave off this bump and shave off some of the extra bone on the cup side and repair the labrum and hopefully prevent the onset of arthritis.
And it's one of those cases, again, if you think you're a candidate, you're having any kind of issues, don't email me, don't call me. I always want to get with the doctor. They know what they're doing. Doc, I appreciate the time this morning.
Thank you.
Thank you.
Appreciate
We're back
it.
with more after this.